If you or your loved one has struggled with arthritis, you know it's not just the joint pain that's tough to live with. It's the thought of how the arthritis will inevitably change your lifestyle that's actually really scary. The thought of not being able to do the activities you love, feeling stuck in a body that just doesn't feel like yours, and all of the emotional stuff that goes along with that. If this sounds familiar, or you or a loved one was recently diagnosed with arthritis and you just don't know what to do next, stick with me. I'm going to show you 5 amazing lifestyle hacks to keep you moving through your arthritis and keep you living the active lifestyle you love. Hi everyone, I'm Dr. Tiffany and I am a naturopathic doctor. And in my practice, I see a lot of arthritis, both osteoarthritis and rheumatoid arthritis. It's not uncommon for my patients to see major changes in their mental health with this diagnosis as well. I've seen a lot of patients with osteoarthritis, and I see them on all ranges of the spectrum. Sometimes they've just started getting some stiffness on waking in the morning. Other times they've struggled with chronic knee and hip pain for a long time. No matter where you are on the spectrum, I'm here to help you by sharing 5 easy lifestyle hacks to keep you moving through your active lifestyle. I see time and time again people struggling with the isolation, loneliness, and lack of purpose because they can no longer do the activities they did and the things that meant a lot to them. This takes a huge toll on our mental health. And that's why, over the next few minutes, we're going to talk about some things we can do to help with both the mental and physical outcomes of arthritis. I want all of you to be inspired or to be able to inspire your loved one to get back into the activities they love and feel happy and healthy again, and maybe even help them find new hobbies along the way. Step 1, exercise. I know this may seem obvious, but it's absolutely critical for the physical degeneration that happens with arthritis and the mental emotional aspect of it as well. There are countless studies identifying massive benefit of exercise on mood, be it anxiety or depression. And oftentimes these studies indicate that exercise is as effective as medication. We have to stop this nasty cycle somewhere, and a great way to do that is by getting a little bit of activity every day. So this is an opportunity for you to get creative. If you or your loved one can no longer do the activity they once loved, let's find something new. If you used to love golf and now your elbows can't take it, try walking or biking around your neighborhood. If you used to love walking and now your knees can't handle it, try swimming. When we exercise, we get our blood pumping and we get the endorphin release, the happy hormones. So from a physical standpoint, when we get that blood pumping, we bring more nutrients and oxygen to the tissues, and we're able to remove more toxins and pain-creating substances that are contributing to the pain that you're experiencing. From a mental emotional standpoint, when we get that endorphin released, we feel happier and more satisfied. To me, this sounds like a no-brainer. There's always something we can do to be more active. When you're ready for the next step, set some goals and choose activities that help you work towards those goals. For example, if I have knee arthritis, I want to choose activities that help me build the strength of the muscles and ligaments surrounding the knee joint. This means less pain and an increase in your ability to recover from activity. So for example, if the arthritis is in your knee, I might start with some walking, then progress to biking, and then you can add resistance when you're ready to build those hamstrings and quadriceps muscles to support the knee joint. Step 2, hydrate. Again, this may sound obvious, but we often underestimate the impact proper hydration has on our bodies. Hydration is beyond important for all aspects of health, joint health included. We've all heard that saying that we're 70% water. Well, imagine you're not drinking enough to support that percentage. Your body will suck water from the less critical areas to support the areas where it really needs it. So for some of you, it might take it from the joint structures to use it for digestion, for example. We have to give our body all of those fundamental building blocks to do its job properly, so it doesn't feel like it has to steal from within to do its job properly. The joints rely on hydration to puff up the structures and buffer the movement. A great example of this is in the discs that separate the vertebrae in our spine. You can picture these as puffy little marshmallows that sit between the bones. If there's an injury or degeneration, the puffiness or hydration becomes even more important. Step 3 is to increase your protein intake. Protein. I counsel patients about protein all day, every day. Protein is the building blocks for collagen, which is a key component of our joints, tendons, and muscles. Without adequate protein, not only can our cells not do what they need to do to heal and repair, but our muscles also can't build strength, so the joint can deteriorate further. Most people I see in my practice are eating nowhere near enough protein. Even if they're meat eaters and they enjoy proteins, it can be really surprising how much protein we actually need. Here's my general rule for how much protein you should be eating. Take your weight and convert it to kilograms. That amount in kilograms, in grams, is the amount of protein you should be having daily. So for a 65 kilogram person, they should be having 65 grams of protein a day. A good sized chicken breast is about 30 grams, so they'll need 2 and a bit chicken breasts a day. It's a lot, right? And that's just for health maintenance. When we have an injury, or if you're an athlete, we need to dose even higher than that. In some of my athletes, I go up to 2 grams per kilogram a day. Great protein sources are meat sources. However, there are tons of vegetarian and vegan sources you can eat too. You just need to make sure, if you're mostly plant-based, that you eat a wide variety of protein sources so you get the full complement of amino acids that build up to protein. My favorite meat source of protein is chicken breast. It's packed with protein. And some wonderful vegetarian sources that you can combine are pea, pumpkin, chickpeas, and lentils. Step 4 is to control inflammation and support joint lubrication. Inflammation can be from wear and tear, chronic health conditions, and even dietary food triggers. I find dietary triggers a huge factor in my patients, for joint pain, but really any type of pain. There are a few ways to find out what foods might be dietary triggers for you. There's food sensitivity testing that can be done, very fast and easy, but by far the most expensive option. You can also do a piece-by-piece elimination of foods or food groups for a few weeks and then reintroduce them to see if your joint pain comes back or gets worse. Common dietary triggers I see in my practice are gluten and dairy, but there are lots of others I've discovered with patients too. The other note about foods and inflammation I want to mention is about the nightshade vegetables. Nightshade veggies, which include potatoes, tomatoes, eggplants, and peppers, are inflammatory. So if I have a patient who's in a real bad flare with a recent injury or has really bad arthritis, I'll recommend they eliminate those for a few weeks as well. There are some awesome supplements that play a key role in inflammation management. One of my go-tos is curcumin, which is an extract from turmeric. It's the best natural anti-inflammatory we have, and I use it all the time, except if patients are on blood thinners. Curcumin can make that worse. One great curcumin supplement is CanPrev Curcumin Pro. I also use bromelain quite often as an anti-inflammatory, and I'll use it with curcumin or instead of if I can't use curcumin in someone. Boswellia is a great herb for this too. The NFH Boswellia sap is an awesome supplement for joint pain. For joint lubrication and stiffness, I tend to lean towards a different set of products. Here I would choose a fish oil, which is also a great anti-inflammatory long-term, and NEM, which stands for natural eggshell membrane. It's that clear jelly stuff on the inside of the eggshell when you crack an egg open. Glucosamine is also an important one to mention here too. Acupuncture is another way to support joint inflammation, lubrication, structural damage, and pain management. I recommend it for all of my arthritis patients. Acupuncture causes an endorphin release and change in blood flow, just like we talked about with exercise. So it can improve the nutrients and oxygen coming to the joints for healing, and also acts on the nerve receptors and fools them to reduce the amount of pain you're experiencing. Inflammation management in itself can reduce pain, but the reduction in inflammation actually slows down the disease process, which is why it's such a huge part of arthritis management. Step 5, the last step I want to highlight, is supporting your overall health, but specifically your mental health. We've been over that nasty cycle that starts with lack of activity and spirals inwards and causes low mood and lack of motivation. There are some great things we can do to help stop that cycle from happening. Exercise and fish oil are great for mental health. In my practice, I use high-dose fish oil to treat depression with good results. The CanPrev Omega Pro EPA has an awesome dose. When I dose fish oil for depression and mental health, I generally aim for 2 to 4 grams per day. And we want more EPA than DHA. With the CanPrev supplement, we can get away with just 1 teaspoon a day for that dose. Dietary fats have a bad reputation, but they're really important for hormone production and that joint support and lubrication. Vitamin D is another one to highlight for low mood and motivation. Most of us here in Canada don't get nearly enough, and it has a huge impact on all of our body systems, joint pain and mental health included. You should get your vitamin D tested and speak to a professional to determine the correct dose for you. I always recommend liquid vitamin D drops for my patient, and most of the time those will be 1,000 IUs per drop. So the only reason to pick one brand over another is preference and taste. Genestra brand has a few different flavors you can try, and the CanPrev one doesn't have much of a taste, so that could be a good option too. So those were our 5 key lifestyle hacks for helping you or your loved one feel their best with arthritis. Exercise, hydrate, eat protein, control inflammation, and support your mental health. Easy enough, right? Let us know in the comments below which hacks you're going to try. Start with trying to implement 2 to 3 of these 5 key steps. This is a great start for getting you back to the lifestyle you envision yourself and the one you deserve. Take this time to set some goals and see how you can incorporate these things into your life. Let's get you feeling more positive and less pain. Thanks for joining me. Again, I'm Dr. Tiffany Zugan. I'm a naturopath here on behalf of the Vitamart educational team. We can't wait to hear from you in the comments below which of these things you're most excited to try. If you liked this video, please give it a thumbs up and don't forget to subscribe. See you next time.